Hi everyone, this is Neel Raithatha, consultant audiologist and director of Clearwax. Thank you for joining me in my latest video using the Waxscope. And here we have a 10-year-old patient who attended with bilateral, fully occluding and deeply impacted earwax. And that was their left ear, the worst ear out of the two. This is their right ear. So the wax was quite deep, but it wasn't impacted against the eardrum on this side. And bless her, she was really, really nervous. And whenever patients are nervous, particularly children, I turn it into a game. So I get the suction tip and I switch the suction pump on, and I place the tip of the suction tip on their palm to begin with, and then on the tip of the nose, and then their cheek, and then on their lobule, which is the floppy piece of cartilage at the end of your pinna. So the pinna is the external cartilage, the satellite dish, if you like, on either side of our ears. And then I just place the suction tip at the entrance of the ear canal just to help acclimatize them to the suction noise. Then I get a bit of tissue and I scrunch it up into a ball and I put it on my palm, and I get the child to hold the suction tip and simulate removing the earwax, i.e. the scrunched up piece of tissue off my palm. And then I start moving my hand with the tissue placed on the palm, and that's to illustrate the importance of staying still, because I then ask the child to try and suction that piece of tissue when my hand's moving side to side, and obviously it's very difficult. And that just helps the child to acclimatise to the procedure, the noise, and the importance of staying really, really still, particularly in cases like this where the wax is quite deep and it's fully occluding, and we're entering with the suction tip into the inner 2/3 of the ear canal, which, so the deeper you go with the suction tip, obviously it's going to be noisier. I did initially try to use a smaller suction tip, but it just wasn't powerful enough, so I had to resort to the 14 gauge standard size suction tip. And because it was so impacted and also dry on the surface initially, I just instilled some medical grade olive oil spray, because I was finding that when I first made contact with the suction tip on the surface of the wax plug, it was almost pushing it further in. And just by applying some medical grade olive oil spray, it can sometimes soften the surface of the wax plug just enough to allow a good airtight seal with the suction tip, which then of course generates more suction power. So I'm just trying to wriggle this and squeeze this out the patient's entrance of the ear canal, which I have managed to do. I didn't manage to take still images, but it was quite a substantial amount of earwax, particularly for a young child. But as you can see, the eardrum's nice and healthy. It's got a nice colour, they've got a good light reflex, there's no sign of inflammation or erythemus or redness, no middle ear fusion, which can sometimes be seen. You typically get an amber coloured, straw-like coloured fluid. Sometimes you can get some air bubbles in that effusion, so fluid behind the eardrum, but it all looks nice and healthy. So I'm just moving on to their right side. So although the wax was in the inner half of this ear canal, but unlike the left ear, it wasn't impacted. And I've just managed to bring this to the entrance, but the plug is larger and greater in diameter than the entrance of the ear canal. So I'm just trying to wriggle this through. Again, I just use some oil just to help soften and lubricate the wax plug. I'm just going to, from the top and from the posterior section, just trying to, you see there's little wriggle movements. They're minute, but they help to just force this wax out of the ear. The wax is quite soft, so it's just tearing away, so I want to get a better suction grip. And I think I've managed to get it at the bottom of the ear. And I'm now going to the top. I'm almost rolling this down and out. I was going to just revert to the curette at this stage, but I felt it was coming away. So by the time I put my suction tip down and get the curette out and re-enter the ear, it would have been quicker just to continue with the suction. And that's that plug. So we're going to re-enter the ear, going to get the eardrum in focus, and just like their left ear, the eardrum looks nice and healthy. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.